Let's think about making medical imaging AI work reliably at scale in a busy clinical practice. I'm Teri Sippel Schmidt, and with me is Raym Geis, a radiologist who is always looking for new informatics tools to make radiologists better, faster, and more efficient.
Teri's an engineer who started companies that build informatics tools that I use. She also developed standards for medical image and healthcare data structures and management. Here are our disclosures.
We both belong to the Society for Imaging Informatics and Medicine, or SIIM. SIIM is the home for everyone who is interested in medical imaging AI. Medical imaging AI is a team sport. We are all just trying to understand this new world. To get there, this is the first in an evolving series of SIIM videos called the Clinical Data Informaticist, or CDI series. Just like any good team, many roles need to work together, including data scientists, statisticians, algorithm developers, IT and PACS admins, technologists, radiologists, process engineers, and business administrators.
SIIM proactively brings together all these roles and more. It's the networking and education hub if you're interested in making medical imaging AI work at scale in production in your busy clinical practice. Are you interested in how to make ML work at scale in the healthcare environment today and going forward? Are you ready to be on the ground floor to invent and run the infrastructure, data plumbing, and probability-based decision-making machines that will revolutionize medical imaging? Medical imaging ML at scale is going to require site reliability engineers, or SREs, to manage the overall infrastructure, data engineering teams to manage databases, data lakes, and warehouses, and orchestration of complex data flows, as well as machine learning engineers and ML ops to manage bringing all these ML models online and offline and monitor them both individually and as clusters. SIIM's where bridges are made between all of these different technical communities in informatics professionals. Take Teri and me. Teri's a whiz at technical stuff. My primary focus is doing radiology, and over the years I've learned about informatics and some about machine learning. But you ask anyone who's been to our meetings at SIIM, and they remark on industry and even students engaging fully with academic folks in the field, how we share stories about our struggles and successes, and the atmosphere is more team than hierarchy. Our sense of cross-pollination is truly what separates SIIM.
And these new positions will be lucrative, as well as stimulating and helping real people, as these data from Glassdoor and ZipRecruiter suggest.
Well, models are the charismatic part of AI, in which we talk about most of the time. To have them work reliably to help care for patients in a trustworthy manner when the stakes may literally be life or death, ML requires a robust, secure data engineering infrastructure that functions with ultra-high reliability at scale.
Medical data pipelines are really complex. Some data, such as patient demographics, history, and lab reports, come from electronic healthcare record in one format. Other data, such as radiology or cardiology reports and images, come from completely separate systems in other formats. Other data can come from prescriptions, ECG recording devices, and other microscope slide systems. This data are often spread across many different healthcare institutions, and there's no one way to even identify a patient between them. On top of that, there's patient privacy and security. It's complex, really complex.
And to make matters worse, the data themselves are messy. Variations down to the pixel level between medical imaging devices and how image reconstruction algorithms work. Radiologists report in different ways and may report on different organs. Some reports are semi-structured or coded. Some are just narrative text. It's messy, really messy. And these are high consequences settings. People can literally die if your systems don't work correctly. But this gravitas also makes our efforts worthwhile.
These systems won't be just one or two AI tools working in isolation. In the not too distant future, we'll have cascades and networks of ensembles of AI models throughout healthcare, sending and receiving information among them and with other people, what are called dynamical network systems.
You want fascinating settings and opportunity? Here it is in spades. We need new methods to manage and monitor medical image data in a more granular fashion, appropriate for this new ML infrastructure in these future systems. Entirely new jobs will build and manage data pipelines with sophisticated orchestration, containers, and methods to bring ML models on and offline in busy clinical practice where decisions have high consequences. Monitoring these systems continuously for data and decision input and output, and quality management both at the data level and the clinical outcome level. We've barely started to explore how to evaluate, validate, and monitor all these different types of machine learning systems over time. How trustworthy are they? How reliable? How do they affect patient outcome, both acutely and in the long term? What are their biases? How do they affect different patient populations? These are but a few of the many questions worthy of future research and worth all of us working together as a team, respecting each other for the skills we bring from different domains and learning, and working together to get this right.
Healthcare and medical imaging have their own languages and standards. We even have our own words and vocabulary represented by a variety of medical coding systems, each with its own focus. We need AI researchers, data scientists to understand medical data formats and protocols for alphanumeric data, such as HL7 version 2, CDI, and FHIR, as well as imaging formats and protocols, such as DICOM and DICOM Web for image transfer and synchronization. And there are other standards, many of which are unique and sometimes idiosyncratic. But we also need the current IT, PACS admins, and business administrators to understand the data distribution, sensitivities, scaling, timing, tracking variations, bias, and population issues. We need the interoperability and semantics profiled in integrating the healthcare enterprise.
With the Clinical Data Informatics series, SIIM and we will bring you brief videos to flesh out medical imaging and AI. We hope to pique your interest in this rewarding and emerging field. SIIM-U, the SIIM annual meeting, and conferences such as SIIM provide in-depth analysis and, like many others in medical imaging, from clinical to engineering to industry and research fields, we love the friendships and cross-field learning we found at SIIM. We hope you join us.